Hi, my name is Sarah. I'm a junior dental hygiene student at the University of Texas Health Science Center in San Antonio. Today, I'm going to discuss the products, techniques, and sequence that I use and recommend for optimal oral hygiene health. To get started, I'd like to discuss the American Dental Association Seal of Acceptance and how it can play an important role in choosing some of your dental hygiene products. The ADA Seal of Acceptance program has many scientists that evaluate objective clinical and laboratory studies that demonstrate the safety and effectiveness of a product, ingredients that have been approved by the Food and Drug Administration, manufacturing standards that assure purity and uniformity of the product, as well as packaging and advertising claims that are supported by science. If this seal has been awarded to a product, it can usually be found on the front of the packaging. A complete list of products can be found by going to www.ada.org. Under the Science Research tab, click on the ADA Seal of Acceptance section, then click on Search the ADA Seal database. Here, you should be able to browse products by their category. I should mention that this Seal of Acceptance really only becomes relevant for certain types of products, which I will discuss shortly. The next thing that I'd like to mention is that the sequence in which you use a mouth rinse, floss, or brush does not make a difference as long as you do a thorough job and use quality products. I do, however, think it is important to establish a sequence as it helps to facilitate the development of a habit. My hope in sharing this with you is that you will find what works best for you. All right, let's get started. The first step that I use during my oral hygiene sequence is swishing with an over-the-counter antimicrobial mouth rinse. The advantage to using an antimicrobial pre-rinse is that it loosens plaque and debris for easier removal while reducing oral microorganisms. This can help reduce the risk of infective endocarditis as well. Listerine is probably the most well-known over-the-counter antimicrobial mouth rinse. However, there are many other brands available that also carry the ADA Seal of Acceptance. Aldi, Costco, CVS, H-E-B, Kroger, Meijer, Target, and Walmart all have this type of rinse under their own labels. I personally use Kirkland, which is Costco's brand, but there's no specific reason why other than that's where I shop. For this type of product, I recommend that you follow the instructions on the bottle. The instructions on mine say to swish 20 milliliters vigorously for 30 seconds, then spit it out. Do not swallow. These types of mouth rinses usually have a strong taste, however, diluting it reduces the effectiveness. Usually if used over a short period of time, the intensity seems to lessen dramatically. The next step that I use in my oral hygiene sequence is the oh-so-dreaded flossing. Flossing is one of the most important steps in achieving and maintaining a healthy oral cavity, and here's the reason why. Around each one of your teeth, there's tissue that is unattached. It forms a sort of pocket around the tooth called the sulcus. Approximately 1 hour after brushing, bacteria starts forming on your teeth and in these pockets. If left undisturbed for 24 hours, the bacteria can actually become harmful in two different ways. The first way is the bacteria begins to colonize. When this happens, a biofilm is produced that adheres to the area and the bacteria begins feeding on different components available in the mouth and producing waste. This waste can cause gum tissue irritation in the form of very small ulcers and abrasions within the sulcus, which in turn cause the signs of gingivitis: bleeding, inflammation, redness, and tenderness. The second way these bacterial colonies become harmful is when they mix with the minerals in saliva and calcify or harden into what is called calculus or tartar. The surface of calculus is rough, which provides an ideal surface for further plaque buildup. Once plaque reaches this stage, it can usually only be safely removed with special dental instruments used by a dental professional. So, back to the main point. All of this can be reduced or avoided by disrupting the bacterial growth process prior to that 24-hour mark. This is why dental professionals recommend the use of oral hygiene products twice a day. Unfortunately, because of the way our teeth fit together, a toothbrush cannot fit into the sulcus located in the interproximal spaces or the space between your teeth. The best way to disrupt the bacterial growth process between the teeth is with the use of floss. As with most dental products, there are many different types of floss and flossing aids. In the past, I have found that flosses that are very smooth, like Oral-B's Glide, tend to miss some of the bacteria, making it easier for biofilm and calculus to form in between the teeth. When beginning to floss, I like to use an arm's length. I also like to wrap a small amount around the middle finger of my right hand, and then I wrap all the rest around the middle finger of my left hand. However, it's perfectly acceptable to leave one end not wrapped around any finger. I like to use a seesaw motion with a slight downward pressure to get the floss in between the teeth without causing trauma to the tissue. Once there, I pull both sides of the floss in one direction, forming a C shape around the tooth. Then dip the floss all the way into the sulcus. I then take the floss back up toward the top of the tooth, pull both sides of the floss in the opposite direction, forming a C shape around the other tooth. Then dip the floss all the way to the bottom of that pocket. I usually remove the floss from between the teeth by taking the floss back up toward the top of the tooth until it is out of the interproximal space. Another method you can use if you choose not to wrap both sides around your finger is just releasing one side of the floss and pulling it through that space. This should be done on both sides of every tooth, even if there is not another tooth in contact with it or if there are spaces between the teeth. For dental implants, bridges, orthodontics, advanced periodontitis, or dexterity issues, special techniques and flossing aids should be discussed with your dental professional. On to the third step in my sequence, brushing. For toothpaste, I do look for that ADA seal of acceptance. I like to know that my toothpaste is going to do what the package says it's going to do. The two brands that have the most types of toothpaste and that have been awarded the seal of acceptance are Colgate and Crest. Arm & Hammer and AIM have also been awarded the seal, and a few other lesser-known brands. I prefer to use Colgate Total because it contains the active ingredient triclosan, which is a broad-spectrum antibacterial agent known for reducing plaque averages by 22% and gingivitis by 25%. When choosing a toothbrush, you have many choices. You can use manual or electric, and there are all types of variations in bristle shape and size, as well as handle shape and sizes. I prefer to use an electric toothbrush because I feel that if I'm trying to do everything that I can to disrupt that bacterial process and my toothbrush is helping me, together we will be more effective. However, many people that I know prefer manual toothbrushes as well. Some things to narrow down your choices, whether you decide to use a manual or electric toothbrush, are soft bristles. This is essential when choosing a toothbrush. Medium or hard bristle toothbrushes can cause serious abrasion to the enamel, exposing the dentin underneath, which can lead to extreme sensitivity. Also, I find it very helpful if my toothbrush has a small head. This enables me to reach in some areas that can otherwise be more difficult. When brushing, there are actually many different techniques that people find to be effective. I use a combination of two different styles, one called the Bass method and the other called the Phones method. The Bass method consists of placing the toothbrush at a 45-degree angle near the gum line, usually with half the bristles on the gums and half on the tooth, then moving the toothbrush using a vibratory motion. For the Phones method, you move the toothbrush in a circular motion instead. Combined, I place my toothbrush at a 45-degree angle with some of my bristles on the gum tissue and some on my teeth. I brush in a small circular motion, ensuring that I am covering all of my tooth, as well as allowing the bristles to dip into the gingival sulcus to disrupt that bacterial growth process. I use this method on the outside and inside surfaces of all my teeth. For the chewing surfaces, a back and forth motion works very well. The recommended length of time to brush your teeth is 2 minutes. I tend to spend anywhere from 2.5 to 3.5 minutes on this portion of my sequence. Also, your toothbrush or toothbrush head needs to be replaced every 3 months. I also like to use a back and forth motion when I brush my tongue. Many people do not realize that the #1 cause of bad breath, other than gingivitis, is plaque on the tongue. You can also use a tongue scraper. This is used by placing it far back on the tongue and gently sliding it down the length of the tongue. You can do this a few times to ensure that most of the plaque is removed. Finally, the last step that I use in my oral hygiene sequence is an over-the-counter fluoride mouth rinse. This type of rinse lowers the metabolism of bacteria, inhibits acid production and carbohydrate metabolism, aids in remineralization of the teeth, and reduces the risk of getting cavities. This is another instance when I turn to the ADA seal of acceptance as a guide. Some brands that you may recognize are Walmart's Equate, Target's Up and Up, H-E-B, CVS, Crest, Colgate, and one of the most popular is ACT. Again, since these all have the ADA seal of acceptance, they all essentially do the same thing and therefore are all acceptable to use. As with your pre-rinse, it is best if you follow the manufacturer's instructions on how much to use and for how long. The instructions on my bottle say to swish 10 milliliters for 1 minute. Spit and do not swallow. No eating or drinking for 30 minutes after. I know this sounds like a very long and drawn out process. However, when actually doing it, it only takes approximately 7 minutes from start to finish. I hope that you've enjoyed this video and that it helps you in choosing the best products, techniques, and sequence for your own oral hygiene habits.